Hello, everyone, and welcome to Grey Matter, your one stop to all your exam preparation needs. As you know, that we have been talking about the different domains of the UKMLA, and today we are going to talk about one of those domains, which is the respiratory section. Now, the respiratory section is very important as it is associated with different symptoms and conditions that are associated uh, with your lungs and your breathing. And these are the presentations that are most commonly associated in the UKMLA. Allergy, the patient can present with different allergies. It can be rash, it can be difficulty breathing, it can be a runny nose. Patient can present with breathlessness, which is the shortness of breath, and which is one of the most common presentations. Patient can present with cardiorespiratory arrest and has to be resuscitated. This is usually in the form of a Simmons station. Patient can present with chest pain. This can be due to trauma or underlying infection, or it can be due to any heart diseases. Cough, another one of the very common presentations. Uh, then comes cyanosis, which is due to the decrease in oxygen and increase in carbon dioxide levels within the vessels, which causes glowing of the skin. And there can be fever, there can be blood in the sputum, hoarseness, a change in the voice, and pain on inspiration, pleural effusion, which is the accumulation of fluid in the pleural space. The patient can present with snoring, stridor, or wheeze. The wheeze is associated with asthma or foreign body. Same goes for stridor, and snoring is associated with snoring is usually associated with diseases that are related to your sleeping, such as obstructed sleep apnea. In the UKMLA, you will remember snoring will be associated with obstructive sleep apnea. Now let's talk about the conditions. The acute bronchitis, it is usually an infectious disease in children, and it basically all the symptoms of asthma in children. You can remember it that way. Allergic disorder, a patient will present with any allergy which includes rash, shortness of breath, or swelling in different parts of the body. Asbestos related lung disease. So basically due to the exposure to asbestos, it can cause a number of diseases such as mesothelioma, asbestosis, or lung cancer. Asthma, we already know what this is. A patient will have patient will be atopic, and there will be some allergic history, and patient will have seasonal allergies, seasonal cough related diseases, and patient will have difficulty breathing. Patient will have repeated cough at night, and will have to be the the investigation should be carried out to rule out the asthma, and smoking history will be taken to rule out COPD, and the patient will be started on bronchodilators or steroids. As now, this is the new topic: asthma COPD overlap syndrome. Now, this is a disease in which the symptoms of both asthma and COPD overlap. So, if the patient presents with eosinophilia, which is associated with asthma, like they have the history of allergy or allergic diseases, and the patient have exposure to smoking, so it is also related to COPD. So both the symptoms correlate. Now that is asthma COPD overlap syndrome. The treatment will be same. The patient will be given bronchodilators and inhaled corticosteroids. Bronchiectasis. Now, this is a disease that is associated with increased mucus production, shortness of breath, cough, halitosis, bronchiolitis. This is a disease that infects the bronchioles and fills it with mucus. It usually infects the children. The treatment will be supportive treatment in this case. COPD, we have talked about it. It is associated with smoking. And the cystic fibrosis, it is a genetic disease. It affects the glands that make the mucus and the sweat. The patient will present with frequent lung infections, shortness of breath, poor growth, or bulky stools. And you will have to check the chloride levels of the body to confirm the diagnosis. The fibrotic lung disease, the tissues around the air sacs, they become damaged. The patient can present with shortness of breath. There will be history of smoking, or family history will be positive. Influenza, which is basically a short, you can call it a fancy name for flu. The flu-like symptoms, it usually infects the children. Patient can present with fever, cough, runny nose, lower respiratory tract infection, same symptoms. The lower respiratory tract is usually infected. Patient can present with flu-like symptoms. It can be viral. It can be associated with bronchiolitis or pneumonia. Now, the difference between the lower respiratory tract infection and the upper respiratory tract infection is, in the upper respiratory tract infection, the cough will not be associated with pneumonia, bronchiolitis. It will be simple flu-like symptoms such as sneezing or runny nose or cough. It will not be associated with pneumonia or bronchiolitis or any underlying infections. Lung cancer, the patient, or metastatic disease, we are going to talk about it in one way. The flaws will be positive, the lungs will be infected, there will be some mass when a CT will be done, or a chest x-ray will show some mass, and there will be hemoptysis, there will be weight loss, fever, night sweats, and this is associated with lung cancer. Metastatic disease, the original source of the cancer will be somewhere else in the body, and the metastasis has now spread to the lungs. Obstructive sleep apnea, patient will present with snoring or difficulty breathing while sleeping, and the patient will be excessively tired during the day, or will be sleepy throughout the day, and the patient will need to be put on CPAP. Occupational lung disease associated with workplace lung diseases such as asbestosis, mesothelioma, pneumonia, very common disease, fever, low-grade fever, and there will be cough, and the patient will present with chest pain that is associated with repeated cough. Antibiotics will be given in this case. In the pneumothorax, the air fills outside the lung but within the pleural cavity. It can mostly associated with trauma, or it can be caused by COPD and asthma as well. In the pulmonary embolism section, it is a sudden blockage in the pulmonary arteries. It is usually caused by the blood clot that travels from your legs, especially in case of DVT. It is confirmed with chest x-ray, ECG, or VQ scan or CT scan. The patient can present with shortness of breath, chest pain, dizziness, or cough. Pulmonary hypertension, it is usually associated, this is the hypertension of the arteries supplying from the heart to the lungs, and it can be it can be caused by some autoimmune diseases such as scleroderma or rheumatoid arthritis. So respiratory failure, patient will present, the ABDs will be abnormal, and the patient will have severe shortness of breath. Sarcoidosis and TB, the symptoms are mostly similar in both cases. There will be fever, weight loss, night sweats. There will be lymphadenopathy. In sarcoidosis, there will be granulomas present in the body, usually present in the lungs, eyes, skin, and heart. The patient will present with SOB, cough, red patches on the skin, fever, and red eyes, swollen lymph nodes, and joint pain. And again, in tuberculosis, only the lungs will be affected. It can present in the spinal TB as well. It can affect the brain as well, and it can be differentiated from sarcoidosis on the basis of CT scan, on the basis of AFP protein, or AFP sputum examination. We have already discussed the upper respiratory tract infection, and there you go. These are the topics included in the respiratory section of the UKMLA exam. We are going to meet you in the next video with the remaining